So you can see the trapezius is kind of a half a diamond, right? It goes from here to here and all the way up to here. Okay? So this is all trapezius. Everybody kind of see that? Okay? The rhomboid is actually deep to it. So it's actually on this side. You can see they've removed the trapezius. Okay? It's this muscle right there. Okay? So that's a rhomboid there. It's actually deep to the trapezius. The trapezius has just been removed on this side. Okay? Then the latissimus dorsi is this guy right here. Okay? So this is the latissimus dorsi. Okay, now as far as the rotator cuff muscles, what are they again? Supraspinatus, infraspinatus, teres minor, subscapularis. Okay, you'll see there's a number of arm models, a lot more in the back there. Okay, so the subscapularis is on the front. Okay, so remember it starts at the subscapular fossa, so it's on the anterior surface of the scapula and goes across. Okay, so the back side, or the posterior side, of course, is, I'm just removing the, what muscle is this I'm removing?
Deltoid.
That's your deltoid. Okay, so the deltoid's easy to see on this. Okay, what's this bone here?
The clavicle?
What part of the scapula?
Oh, scapula.
Spine of the scapula, right? So the muscle up here would be which one? Supraspinatus. The muscle right underneath it? Infraspinatus. Okay, pretty easy to see there, right? And then we said down here there's two of them, right? What were they? Teres major and minor. So I'm pointing to those two, okay? Now which one is the more superior one, closer to the infraspinatus? Minor, right? Because that's part of one of the rotator cuff muscles. So this one is which one? Major. Teres major. Everybody see that? Okay. So those are the rotator cuff muscles, and again, it's best to find those on the arm models. And again, there's a lot of arm models in the back. Okay. So we talked about the trapezius, rhomboid, latissimus dorsi, supraspinatus, infraspinatus, subscapularis, teres major, minor. Okay, pector and the deltoid. So the chest muscle is the best model. There's a few other chest models like this. Okay, so what's this one? Pectoralis major. Now on this side, the pectoralis major has been removed. Okay, so you look at the muscles deep to it. So what's this one? Pectoralis minor. Remember ribs? Now I said ribs 3, 4, and 5. On the models we use here, they actually have rib 2 as well. Okay, so technically it's ribs 3, 4, and 5, but the model sometimes will show rib 2 as well as an origin of the pectoralis minor. Okay, then you see these muscles here. We said there was muscles at ribs 1 through 8, and they go around the rib cage and attach to the scapula, right? So what was this? Okay, these muscles look like they've been cut, right? Cut. Cut. What's the word for cut? Serrated, right? So serratus anterior, okay? Right? You hear of a knife that's serrated. It's got the little individual like blades, right? It's a cut, right? So serratus anterior. We see serratus being, think serrated, right? Like cut in pieces. So you can see how this muscle looks like it's been cut in these 8. You see that? Okay, so that's a serratus anterior. Okay, we talked about deltoid, pectoralis major and minor. Okay, external and internal oblique. Okay, so these are the muscles where? On the abdomen, right? So remember we said the most outer layer is which one?
External
oblique. Deep to that? Internal oblique. But you can see on these models it's not totally clear which is the most outer and which is more inner, right? So you need to be familiar with the direction of the fibers, right? So you can see on this one, these fibers are going this direction, right? In V, so this is what? External oblique. Now you can see on this side, these fibers are moving in this direction, right? That's internal oblique. Does that make sense? Okay. And then these guys in the middle here, the fibers going up and down, that's what?
Rectus abdominis.
Rectus abdominis. Now, The deepest layer, and you can see it on this side, you can see how these fibers go horizontally across, right? That's a transverse abdominis. Okay, people see that?
Yeah.
Okay, the diaphragm, okay, hopefully we can all find that one. Okay, of course the diaphragm separates what and what? The abdominal cavity and the chest cavity or thoracic cavity, right? So you can see this dome-shaped area here, right? This is all diaphragm here. Okay, obviously the chest cavity superior to it, abdominal cavity inferior to it. See how it's dome-shaped there?
Mm-hmm.
Okay. All right. And then, as far as the external and internal intercostals, those are the muscles where? Between the ribs, right? So, same thing on this model here. If you look at the ribs here, and I don't know for those of you in the back it's hard to see, but some of these muscles, its fibers are oriented in this direction, and these guys, those muscles are oriented in this direction. Okay? So if this fibers here are oriented in this direction, that's the V, right? So that's what? External intercostal. These guys here are oriented like this. Internal intercostal. Okay, so make sure you can distinguish those between the ribs. Okay? Now, what I would highly suggest you do is the first thing is you need to be able to name them. Because the way the exam is going to go is I can, on the practical, ask you to name this muscle. I can ask you to name its origin, insertion, or action. Okay? Now, if you name the wrong muscle, okay, and you put the wrong muscle, but you put the proper origin, insertion, and action for the wrong muscle, you get them all wrong. Okay? So you got to, first of all, the first thing is you got to name the right muscle first. If you don't name the right muscle, you're probably not going to get origin, insertion, action correct. Okay? So the first thing you want to be able to do is make sure you can name the proper muscle. So what I would recommend, of course, in lab, is spend your time mostly making sure you can identify the proper muscle. And then you can go back and memorize origin, insertions, and actions later on. Okay?